Welcome to today's HealthLine webinar from the American Association of Kidney Patients titled Caregivers Corner, Supporting Those Caring for Military Members and Veterans with Chronic Conditions. Thank you for joining us today. My name is Jerome Bailey, Director of Patient Engagement and Advocacy for the American Association of Kidney Patients. Today's webinar is especially timely as we honor Veterans Day, a day that highlights the service and sacrifice of veterans and the critical need for supportive healthcare resources for them and their caregivers. Veterans and current military service men and women make up a substantial portion of AAKP's membership, representing all branches of the U.S. Armed Services, from the recent services in the global war on terror back to World War II. Veterans are disproportionately affected by chronic kidney disease, with rates estimated to be 34% higher than the general population due to unique demographic factors and prevalent comorbidities like diabetes and hypertension. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host our webinar series as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to available treatment options. To open today's program, it's my pleasure to introduce AAKP's President and Chair of AAKP's Veterans Health Initiative, Edward Hickey. Ed is not only a kidney patient, but also a seasoned advocate and caregiver. He brings extensive experience from both military and public service, having served as a U.S. Marine Corps infantry officer and in senior roles on Capitol Hill and in the White House. Ed, I'll turn it over to you.
Thanks a lot, Jerome. It's good to see you. And welcome everyone to today's HealthLine webinar. As Jerome just told you, my name is Edward Hickey and I'm the president of the American Association of Kidney Patients. Personally, I'm a kidney patient, experienced care partner, and advocate due to a long history of kidney disease within my family. I'm also a former Marine Corps infantry officer, as he mentioned, with a career in public service that includes senior roles on Capitol Hill as an administrative assistant in the House of Representatives and appointed service under 2 U.S. presidents. Throughout my career, I've developed a deep understanding of how federal cabinet agencies, including the U.S. Department of Veterans Affairs and its many programs, impact long-term healthcare research and innovations in diagnostics, drugs, and devices. Currently, I'm a practicing attorney in Los Angeles and am active in the Armed Forces legal community here, working locally with the Veterans Legal Service Project of the LA County Bar Association and nationally to support the legal needs of active duty military personnel, reservists, and veterans. Over the past decade, I and others from AAKP have invested significant time in aiding the U.S. Department of Defense in their medical research programs. I've served as a DoD peer reviewer and am very involved in advocating on Capitol Hill for more funding for healthcare research and programs so the VA and the Department of Defense can continue their fine work. I'm also chair of AAKP's Veterans Health Initiative, which was launched in 2017 to advance research, innovation, and policies aimed at safeguarding the highest standards in kidney care and treatment for veterans managing kidney disease, both inside and outside the VA medical system. In 2023, AAKP announced a new partnership with the U.S. Department of Veterans Affairs. This formal collaboration aimed to improve healthcare outcomes and enhance the overall quality of life for veterans with kidney disease and is facilitated under the Veterans Health Administration's National Center for Healthcare Advancement and Partnerships. Over the course of this partnership, AAKP and the VA have shared a mission of providing people facing kidney-related issues now and in the future with access to the best research and healthcare innovations in the world to manage their conditions. And it is with that that we are pleased to partner with Canary Health, an outstanding organization that is helping active duty military support programs to help managing chronic kidney illnesses. I'm very excited to learn more about what great programs and activities they have, and I'm sure that you are too. And with that, Jerome, I turn things back over to you.
Thank you, Ed. I appreciate you being with us. In preparation for today's webinar, AAKP conducted an independent flash survey through our Center for Patient Research and Education to get a sense of the intricate challenges caregivers of veterans and military men and women with kidney disease face. Let's dive into the survey. This survey captured insights from a diverse group of respondents across our network. Among the primary caregiver tasks, respondents noted medication management, coordinating dialysis treatments, monitoring symptoms and vitals, managing medical appointments, and assisting with personal hygiene as the areas they help with most frequently. We found that a majority of respondents dedicated 20 to 40 hours each week to caregiving duties. 60% of respondents feel they are equipped to manage the medical needs of their loved ones with kidney disease. When asked about the most challenging aspects of caregiving for a veteran with kidney disease, 40% identified emotional stress as their biggest challenge. This was followed by the physical demands of caregiving, coordination across multiple medical appointments, and limited respite or support services. When we asked what additional resources would be most beneficial, the top responses were more education on kidney disease, access to respite care, and mental health support for caregivers. 80% of respondents admitted they sometimes feel overwhelmed or stressed by their caregiving responsibilities. Interestingly, 80% of respondents stated that caregiving has had no significant impact on their professional life. However, the same percentage indicated that it has affected their social life and personal relationships. The insights from this survey underscore the unique challenges veterans and their families face, especially when managing kidney disease and other complex chronic conditions. These findings highlight the importance of continued support, resources, and policy initiatives to better serve our veterans and their dedicated caregivers. That is why we are pleased to partner with the Canary Health Building Better Caregivers Family Caregivers Program, which is designed to support and empower all caregivers, including caregivers of veterans and current military men and women. The Building Better Caregivers program offers tools to help make life a little easier for caregivers and less isolating. To begin, I'm honored to introduce Dr. Neil Kaufman, Chairman and Chief Medical Officer of the Building Better Caregiver Program. Dr. Kaufman is a primary care physician and public health expert with over 40 years of experience providing healthcare, developing community-based services, and creating internet-based behavior change interventions. He lives in Los Angeles with his wife of 50 years, and they have 2 adult sons with 5 grandchildren. Dr. Kaufman is joined by Peg Rowe, a facilitator in the Building Better Caregivers and Better Choices, Better Health programs. Peg has a deep personal connection to caregiving, having been the care partner for 3 individuals, 2 with various stages of dementia, including her late father, a veteran, and currently cares for her stepmother and sister. Please join me in welcoming Dr. Kaufman and Peg.
Good morning or good afternoon, wherever you may be. Andrew, Jerome, I appreciate you arranging this webinar. I want to thank the association for the opportunity to present. If we could have the first slide, please. After I give you a brief introduction to Canary Health and the programs we have, I'll be talking with Peg Rowe, who is a chronic kidney patient as well as facilitator, about her experiences. We'll then move to the second segment where we'll talk about the power of peers and describe how to use your own practice to be able to ask for help, and put a plan in motion. We also give data from our Caregiver Insight Club, which we've done interviews and surveys that explain and go into a little more detail than the one that Jerome just presented. And then at the end, we'll give you more details on Building Better Caregivers. So very, very briefly, Building Better Caregivers is a 6-week online workshop which helps individuals caring for their loved one with a chronic illness to improve the caregiver's skills, physical and mental health, and overall well-being. At the end of the 6-week program, the individual has more confidence, increased self-efficacy, that they're able to care for their loved one and care for themselves. Briefly, how it works, individuals on a Monday start in a workshop that lasts 6 weeks. They join 30 other caregivers and 2 facilitators who are caregivers themselves who facilitate the program. So it is peer-led and peer interactions. Weekly, they attend a lesson where they have static content that they read, but they also pick a tool to try to help them with a challenge that they might have. They create what's called an action plan, which is a very sophisticated and research-proven effective way to identify things you would want to do and to learn how to become successful at whatever you choose to do. They would use that tool, feedback, and give and receive feedback from other caregivers in the sense that they're able to interact with them on the website and get support for questions or concerns that they might have. And then they share their progress, their celebrations with their other caregivers. I now want to interview Peg. So Peg, if you can introduce yourself and tell us a little bit about your experience living with chronic kidney disease.
Sure, thanks for the opportunity. I was diagnosed with kidney disease about 30 years ago, and it was a shock. There was nothing in my family that would indicate this. I'd never been sick or anything. So I started out on peritoneal dialysis for about 1.5 years, and then for health reasons, I moved on to dialysis for about 3.5 years. And it just so happened that on a day of my treatment, I was finishing up, I got the call that they had a kidney match, and I had a kidney transplant the next day. So 25.5 years ago, and still going along. So each treatment option came with its own benefits and its own challenges. And it was necessary to be able to adapt, the quicker the better. And each treatment option came with different emotional ups and downs, different needs, and kind of a roller coaster of emotions and experiences. And the feelings of isolation, being overwhelmed, fear of the future, all of these things played into how I dealt with kidney disease. And because I had a chronic condition, I found the opportunity to teach a course called teaching a course of people living a healthy life with chronic conditions and facilitating that course. And then I became a caregiver, and the opportunity to join the Building Better Caregivers as a facilitator came into my lap, and I thought, what a perfect joining, because not only was I someone with a chronic condition, happened to be kidney disease, but I also was a caregiver. So it was a good, it was a good marriage of experiences that I could offer.
And what strategies and tools have you used along the years to help you to manage yourself as well as to help manage those you were caring for?
Well, as I mentioned, the emotions is a big part. The loss of independence and the fear of the future can get really overwhelming. And I needed to find a way to gain some sense of control. So for me, I started making a plan on a daily basis, something as simple as I'm going to exercise at 10 o'clock. You know, something that I had total control over. It was all mine. And then I could carry it out and feel satisfaction that I had completed it, something that I personally controlled while the kidney disease was in the background, something that I didn't have control over very much at the time. Another strategy I used was finding out that asking for help wasn't really a sign of weakness. And I'd always been independent to a fault. And it was very difficult at first to, first of all, figure out what I needed and who am I going to ask, where's the resources. But I was very surprised when I finally summoned up the courage to ask for help. And I was surprised when I got the answer, yes, I'll help you. And it was a big breakthrough for me. to be able to
They
do that.
probably, they probably said to you, "Why didn't you ask sooner? I was waiting for you."
You know, I kind of felt that way and said, how crazy can I be not even thinking that I could have asked for help from these folks?
Can you elaborate a little bit more on how you think caregivers and patients with chronic kidney disease can work together to improve outcomes for both parts of the dyad?
Yeah, there are lots of ways to support someone with kidney disease. As a caregiver, you can offer support by helping to understand the intricacies and the emotions that your kidney care partner might feel. They can partner in helping to manage the diet, which often has to change when you have kidney disease. There are lots of medications that are needed, and managing the medications. What are they for? When do you take them? What happens if you don't take them? Getting the proper exercise. All of these things are ways that you can help each other. Traveling to appointments, traveling to dialysis if that's on your treatment plan. Helping each other monitor symptoms. I mean, I could go on forever. There's a lot of lifestyle modifications that have to be managed, and partnering up to manage those is really helpful. Some people do home dialysis, so having a partner to help you do that is really important as well. And it can help the outcomes if you have a good close partnership between you and the person who has kidney disease.
What would you say is the biggest challenge facilitators have when you're facilitating the BBC workshops? What comes out most commonly?
What comes out most commonly, I think, is emotions. If you are using this example, you both have emotions. The caregiver has emotions, the care partner has emotions. They may be similar emotions, but with different causes, and they manifest differently. So understanding each other's emotions and finding ways to manage that is really important. But with kidney disease in particular, you want to make sure you're up for the changes that happen pretty readily and pretty quickly. Kidney disease is a delicate balance, so you have to stay on top of things, and that can be a real challenge.
As a caregiver, did you find the asynchronous nature of BBC, meaning that we don't come together like on a Zoom, but you can go on 24/7, 2 or 3 times a week, makes it easier, makes it more feasible? What if the participants said to you?
I think that was a real plus because you didn't have a certain time when you had to log on. You could log on whenever it was convenient for you, and that could be a 24/7. And it really made it easier for the people for the caregivers, because as a caregiver, your time is constrained to a certain degree, and you want to be able to pop on when you have a few minutes.
Great. Okay, thank you so much for sharing your story and your insights. I'll send it back to Jerome for the next introduction.
Thank you, Dr. Kaufman and Peg, for your enlightening discussion there. I appreciate it. Next, I'm pleased to introduce two more key members of the Building Better Caregivers team, Katie Plant and Candy Dana. Katie Plant is trained in public health, has more than 20 years experience in digital health. She spent 15 years at Stanford University as a researcher, working on studies in women's health, chronic disease prevention, and caregiving. She was also a product director at the National Council on Aging and is one of the original creators of the Building Better Caregivers online program. Joining Katie is Candy Dana, a peer facilitator, manager, and business analyst for the Building Better Caregivers program. Candy has a 30-year background in community education and has worked extensively in evidence-based health programs at a teaching hospital. She's a passionate advocate for caregivers and has developed award-winning programs to promote healthy lifestyles and caregiving support. Candy enjoys volunteering for several organizations and spending time with family and friends. Please welcome Katie and Candy to the program.
Great. Thank you so much, Jerome. Nice to be here. And I'm also a caregiver myself. I have a young son with cystic fibrosis. So many of the things that I heard Peg talk about, no matter what the condition, there's a lot of overlap in terms of what the person living with the condition feels, as well as us caregivers. So Today, Candy and I are going to transition a little bit to preview a couple of the activities that we use in our programs that caregivers tell us over and over again that they continue to use. Those two are finding or asking for help, which I think Peg alluded to, and then also how to put a plan in motion. So a lot of what we do in our caregiver workshop is to help caregivers create a toolbox. It's a lot easier to confront challenges that we might be experiencing, either living with a condition or caring for someone with a condition, when we have some tools to use in different situations. And not all these tools are going to work every time. That's why we build this toolbox, so that we have many different solutions to use depending on what we're facing. Some of these might look familiar: making decisions, planning, communication, problem solving. These are things that often we do daily without even realizing that they are tools for us. They're actions that we're taking to have a sense of direction or control, especially when things are starting to feel like they're spiraling. It's nice to have some go-to things that we know can work when we're feeling that way. So having a well-equipped toolbox helps us to understand what tools work best, what kind of help we might need in a particular situation, to be able to better communicate to others, including when our care partner might have behaviors that are hard to understand for us. We're going to dive a little deeper on two of these. I'm going to turn it over to Candy to talk to us about asking for help.
Our decisions may involve or be about people, and getting some help may be necessary, as Peg kind of talked about earlier. And everything on this list is really vital for keeping communication good on the forefront of all of our relationships. But to get to the point of asking for help takes courage and good communication. Good communication is really the glue that holds our relationships together. And I'm guessing that all of us have been in the position of needing to ask for help at some point of time. Some misunderstandings can grow until they cast a fog over a situation. And sometimes we're not clear about our wants or needs, or we may not even understand what type of help that could be given in a situation, or what we may need in that situation. We may not know where to start, and sometimes we make assumptions about the help or advice we have received, and sometimes those trying to help have offered unwanted advice. There can be information lacking on both sides of the conversation. Timing is everything, as well as having too many options. The important part is good communication. Sometimes the breakdown in communication happens when we're not honest about what support we need, especially if it means admitting that we need help or aren't able to do things as we used to. And sometimes others expect and we are not able to follow through. Caregiving takes a great deal of time, and a breakdown in communication provides undue pressure that can decrease our confidence and ability to provide care. And often family and friends want to offer help, but it's up to us to share with them how they can help and what is needed. We can't expect them to just know. The list on the previous slide can help guide how we build the habit of expressing our needs. And the more honest and direct we can be will allow us to avoid any misunderstandings and more likely lead to positive results. I messages are important in that we frame our perspective in the situation. It explains where we're coming from. And with iMessages, we're able to express our feelings honestly and how we feel, and we are showing ownership of what we're bringing to the situation. I'm going to read a couple of the statements. I know this may be asking a lot, but I need help with grocery shopping. Would you help me? Or, if I give you a short list and some money, would you mind picking up some groceries for me the next time you go? While both are good examples of iMessages, The second one is more specific and has clear direction included for the person we're reaching out to. The second one also provides more information for the person to work with and how to step up. This one enhances the partnership in the solution. Using I messages can also help in times when we need to use our no voice or to turn offers down graciously that we don't need or want. Perhaps the person sends you flowers or offers to cook you a casserole, but there are things around the house that you need more. The third example offers a way for us to nicely clarify what we really need. What I really need is help with some of the chores, and which of these can you help me with? Can you help with laundry or maybe cleaning my bathroom or helping me straighten out the garage? Being more specific, we get what we need, and the person who wants to help knows what they can do and be there for us. Many people do really appreciate knowing what is needed. The hard part about communication, though, is the you messages that sometimes pop in, and we have to be careful because I messages can easily turn into you messages. You messages tend to be more aggressive, can come across hostile, and put the receiver on the defensive. And this can block any further communication. We have to be careful and watch out for those hidden you messages. When I feel is stuck in front of what we're trying to say, we are really sending a disguised you message, as an example on the slide. You might have your own way you would adjust these to have a more positive impact, but listen to these potential solutions for the you message. I must not be clear. Let me explain again. Or, I feel I'm not being heard. Another one might be, I need help with chores. Is there a day you can help? And this one also works. I feel like I don't know what to do when you express your anger at me that way. Now I'm going to turn it back to Katie, and she'll talk us through action planning.
So another tool that we use in our workshop a lot is called action planning. And I think a lot of us probably have experience making goals. A classic example is you start the new year and you want to lose weight. And oftentimes people aren't successful because they have this really big goal and they don't break it down into smaller, doable things that they can feel confident about accomplishing. And so that's where action planning comes in. So I'm going to walk you through kind of what we call our action plan recipe here. And I invite all of you to make an action plan with Candy and I, and we'll do that in a moment after I walk us through the pieces of the plan here. So an action plan is something that you want to do, not something that someone else is telling you that you have to do. It's something that's achievable. So it's something that you can accomplish in about a week's time. It's behavior or action specific. So that example of losing weight would be the outcome of it, but what's that specific action you're taking, like cutting snacks, would be the action plan. And it gets really specific about like what it's going to answer. So what are you going to do? So this example could be, I want to exercise and go for a walk. How much of it are you going to do? So, really thinking about it, because we can all say I'm going to exercise this week, but life happens and things come up. So thinking about what day that is, how much time you're going to spend doing it. When are you going to do it specifically in your day? Are you going to do it on a lunch break, or are you going to do it later in the evening, take a walk after dinner, whatever that might be, but really like visualizing yourself doing it and thinking about the best timing for that. And then this one's real important. It's about how confident you are that you can do this. So your confidence should be on a scale of 0 to 10, with 0 being I'm not confident at all that I can achieve this, and 10 being very confident that I can achieve this. And think about that time frame of this is a plan I can do in the next week. And I'll invite you in a minute to make your own, but thinking about having a confidence level somewhere between 7 and above. And if it's not that, we'll talk about some solutions of things you might try if it's less than that. So Candy and I are going to make our own action plans. And my action plan this week, I have a lot of appointments that need to be made, either for myself or my kids. So my action plan is to make those appointments. My broader goal is trying to be more part of the healthcare team and being able to work with them. And so I need to have these 5 appointments made. So I'm going to spend about a half hour on Thursday and a half hour on Friday doing the things that I need to do to make those appointments. And my confidence is about an 8 that I can succeed in doing that this week. Candy, how about you? What's your action plan?
Well, I am going to try to track my protein intake and my sodium intake because the chemistry is really important in dealing with chronic conditions. And so over the next few days, I'm going to track on both weekends and a weekday. So that way I know if my day's off, I'm getting the appropriate amount of protein and sodium intake, as well as on days that I work. And my confidence level is an 8.
Great. So I invite all of you to think about something that you want to accomplish between now and a week from now. If when you think about it, your confidence is less than a 7, both Candy and I have been action planning for a while, so we're confident that we can get this done at an 8. If you were in a situation where you're finding it's less than 7, I would invite you to think about, are you taking on too much? Are you biting off too much? Can you break it down into doing it at different times, or thinking about what the barrier is to being able to have a confidence level of 7 or more. In our workshops, we do this as a group where everyone makes an individual plan, but I can see Candy's and I could see Neil's and I could see Peg's, I could see everyone's plan. And I could see if their confidence was high or not. And then they could help me if they see my confidence is low, they could jump in and give some examples of some things that might help me to have a higher confidence. So it's a nice activity. We find that caregivers, it sticks with them as they even finish the 6-week workshop, as they continue this habit of making action plans. All right, I'm going to transition back to Jerome.
All right. Thank you, Katie and Candy, for your valuable insights and dedication to supporting caregivers. I really like that activity. I appreciate it. Our final speaker today is Karina Horofsky. Karina is a mixed method researcher, strategist, and analyst for the Building Better Caregivers program. She brings a unique combination of healthcare policy, management, and design research to the team. With a decade of experience in analysis and research, it's my pleasure to welcome Karina to the program.
Thank you for this introduction. So we're going to take it a little bit further and looking at what things we have learned through our community, because we are quite fortunate. A lot of our alumni and also a lot of, just generally speaking, people who can contribute and who do join our Insights group that we're going to talk in a moment about, have shared a lot of information with us, and we're sharing it back with the community. So before I start, let me tell you a little bit about a very recent research that just came out in September 2024 by RAND, and it showed something quite interesting. They had done a survey or a research, a study 10 years ago, measuring how many caregivers there were in the population. And they've done this again now, a decade later. And the findings were incredible because back then they had 5 million people who had been identifying as caregivers. And now, through an expanded definition, they had over 14 million, which is such a big increase. And of course, it might not just be the definition itself, there might be other factors at play as well. But certainly one of the things that caught our attention was how, when you explained what caregiving is and allowed people to talk about the tasks rather than the identity, they actually could better estimate how many people were caregivers. Let me show you a little bit how that looks like. When we ask the question, which of the following tasks do you perform on a regular basis? Things like helping provide personal care, giving medicine or treatments, driving someone to an appointment, helping someone remember things that perhaps they've forgotten, helping managing symptoms of psychological disorder, and other tasks that basically represent what a caregiver's typical day is. We started seeing that increase of people who fit those different criteria, and therefore were actually caregivers. So what that showed us was that in fact there were 14.3 million caregivers in the veteran and military caregivers community, right? And this was a considerable shift from simply asking, do you identify with the caregiver label, right? Are you a caregiver as an identity? Versus what task are you actually doing? And those being the tasks of caregivers. So one more item on that was interesting was that when you're looking at stress and burnout and depression, it turned out that all caregivers were struggling with this in equal measures. So whether it was someone from the civilian life or someone from the military and veteran community, this is common to all caregivers because it is a very demanding and sometimes difficult role that we step into. We were very intrigued by this and wanted to go a little bit further and understand even better what is difficult about reaching out to caregivers, having them be able to accept the help that they're given, and being able to really benefit from all of the things that caregivers can have access to. And what we found in looking at this was that there is no one definition, but many, and we're going to talk about this in just a little moment. And also we've identified what we would call the caregiver identity paradox. Let me show you a little bit about that first question of definition and many plural of definitions. As we've seen, caregivers do a lot of different tasks. When we're trying to understand what is a particular challenge for the caregiver, it unearths so many different dimensions because the caregivers happen in a certain stage of life, or with a certain disease, or in a certain situation where they're helping remote or in person. There are a lot of different ways in which caregiving can happen. And you see here a couple of these different ways, which I'm going to talk about in just a second and highlight a couple that might be interesting to you particularly. But in essence, what we noticed when we started running these studies with different caregivers was that there is no one definition. There are so many different definitions because there are many facets. There's many ways or situations in which people become caregivers and many challenges that they face that are very unique to them. So let me talk about 4 of them in particular that you might find interesting. All right, so the first one that we're going to talk about is 24/7 care. Something that is quite unusual sometimes is people might have taken care and helped a little bit for a short period of time for a loved one, but in certain situations, care might shift to become a 24/7 job. It means you live with the person and you are really on, whether it's night or day, and that really affects the different schedules, the different rhythms that we're used to, and that was in some cases a new challenge for caregivers to be able to adapt to. Another one was facing mixed emotions. So we saw that this was actually common to a lot of caregivers in all kinds of walks of life. The experience is twofold. On the one hand, there could be good feelings, right? Good experiences. We're really thrilled to be able to support someone that we love. We are happy to and grateful that that person's still there and we can take care of them. We might feel that there's a lot of personal growth that is happening through the journey that we're having as caregivers. So a lot of elements that can be really positive. At the same time, there can also be feelings that are not as positive. For example, we might get really tired sometimes and exhausted. We might, as we just saw in the statistics before, become a little bit less in touch with the people from our lives. And then we start struggling between those feelings, sometimes even feeling guilty about them. So managing those mixed emotions was another staple of the caregiver's experience. Another one was looking at uncertainty, and this one was actually one of the most popular, one of the top 2 that came back again and again, no matter what the situations particularly that was for each caregiver. And this idea of uncertainty is that, as you well know, things progress. So a caregiver might gain certain skills, they might find certain strategies that work, and then either the disease progresses, or something in the environment changes, or access to resources change. So the needs keep evolving and changing, and it is very hard to predict what is it going to be like tomorrow, in 6 months, in 2 years. And yet there's that desire for safety and comfort and knowing that we're ready and we can handle it. So this notion of planning for uncertainty was very much top of the mind for many caregivers. And the last one I'm going to talk to you about today is caring as part of a team. And this is really interesting too, because caregiving can happen in different ways. Some people are the sole caregiver and they are the one person making all of the decisions, but also they can only rely on themselves. At the other end of the spectrum, you have people who are part of a caregiver team. Part of that could be siblings or other people in the family, but also you could view the medical team as an extension, right, of that caregiving team. And there's a lot of things to be explored about how do I connect with people who are part of that extended caregiving team, and can I, for example, have more access to information, communicate better, all of these things that help the synergy in the end, the everything coming together with the team as opposed to being by oneself, right? And also reducing frictions and making life a little bit easier with those positive interactions. So these are all different aspects and many facets of caregivings where people can fall in different spectrums and so on. So what this all means is that when you're trying to talk and reach out to caregivers, it may be very hard because there is no one caregiver role, right? One caregiver profile. There's multiple profiles. And so when they fall on literature or programs or advice that tailors to caregivers, it might actually be really hard for them because they might not recognize their specific scenario or their specific situation in the specific example that was showcased or designed for when someone needs a program or some kind of piece of information that might help them. The second challenge that caregivers really run into is this idea of identification. In the early phases, there's a lack of identification, which we'll talk about in a moment. And in the later phases, we noticed over-identification. And both of them mean something in terms of how you access help and get the resources you need. So in the early phases, the lack of identification comes from things like you'll hear them say, well, I'm not doing anything special. Anyone would do this for grandma, for their husband, and so on. Or they might not realize that the task they're engaged in is actually a caregiver task. So for example, they might just say, well, I'm just getting the groceries. And what typically happens with these is that these small tasks are the entry point. They're often some of the very first caregiving tasks that a person will be called to do. And over time, as the illness or the situation progresses, that small task will become magnified, that there will be other tasks that are coming into the caregiver's life and gradually stepping into that role. But very often, initially, the caregiver does not actually identify this. And finally, they're unfamiliar with the term caregiver. And so when the diagnosis is first received and the loved one or the person caring for them happens to hear about it, sometimes we don't actually talk about the idea that they are a caregiver, that they might need resources and help and to learn how to step into this new role. And so they might not go on Google and think of typing caregiver program or caregiver resources. They may just not be aware that caregiving is a thing. When it gets to later phases, we fall into over-identification, which is the other end of the spectrum. This is when you'll hear things like, I fell out of touch with my close friends, or I really miss swimming, or I left work so I can be at my best as a caregiver, or even what's going to happen after when we understand that things might change and we might have to adapt again and redefine our role and who we are and how we operate in the world. So all of these, ironically, make it just as difficult to receive help as a caregiver because at that stage, the caregiver really thinks about the giver aspect. They are the one giving care to someone else. And so they're thinking, well, I don't receive care, I give it. And yet, when a caregiver does receive help and is in a stronger place, they can actually even be a better caregiver and have more to give to their care partner because they're in a good place. So it's very important to learn to manage those resources, whether it's energy, the mood, anything that really impacts the quality of the life of the caregiver, so that both the care partner and the caregiver can really make the most out of life and of the situation too. Through the different research projects we've conducted, we were able to really map out all of those different dimensions that we mentioned at the beginning, which make up the different facets of the caregiving experience. And we also were able to collect different stories that highlight what the experience really is like and what are the challenges and the particulars of each kind of caregiving experience, which is really very unique in its kind and yet shared by so many other caregivers who share that specific setting, those specific life stages or disease stages that really brings things together. And we've mounted a website that we've made available for free and that caregivers can go and visit if they would like to see it. And we are also recruiting always into the Caregiver Insights Club more caregivers who want to share with the community, who would be open to perhaps an interview with us to share a little bit their story and their thinking about the different challenges that are met by caregivers. And these we share back with the community, as in this presentation, as on the micro website, through different videos to help caregivers recognize themselves as caregivers, connect with the stories of others as well, validate a little bit the experience, and get a little bit educated, a little bit more about what their needs might be and what kind of things they might want to think about and plan for as they move forward. And if you would like to perhaps help support your caregiver and help them connect to that community, and specifically the Caregiver Insights Club, we invite you to write to tell them about it, or have them write to info@canaryhealth.com, and we'll send them the micro website that features all of these profiles, these different caregiving aspects, as well as the information about how they can contribute as well to this research with the Caregivers Insights Club. And the second way in which you can also support them is to invite them to join the Building Better Caregivers program. And for this, I'm going to invite Katie to share a little bit more on the program.
Neil gave us a little bit of an overview. I just want to bring it home here and tell you how you can sign up. Or how you can direct your caregiver to sign up. So Building Better Caregivers is a 6-week program. We start workshops pretty much every Monday. It's available through your browser, so you can have that on a tablet, on a computer, on your phone, and you go through weekly lessons. There's a group of about 30 other caregivers that are in the workshops with you. They're done asynchronously, so you don't have to log in like you did today at a very specific time. You go through the lessons, you're able to be on moderated discussion boards. There's a book that goes along with the workshop as well. And when you're all done, you're able to be part of a larger community where we have an alumni community. This slide just talks through some of the topics that we discuss. You've had a little bit of a preview of action planning and problem solving. We look at a lot of other things around helping with caregiver stress. Often caregiver stress comes from difficult emotions that are happening, or care partner behaviors, difficult behaviors that are happening with the person they're caring for. So we spend a lot of time unpacking and identifying those triggers. And then a lot of things around self-care, because honestly, sometimes as caregivers, we forget to take care of ourselves because we're very consumed with caring for others. So it's a good reminder. So as part of Caregiver Month, well, 2 things. If you're caring for a veteran and that veteran is receiving VA healthcare, there's a tremendous program at the VA called the VA Caregiver Support Program, and we are one of the programs that they offer. That website is va.buildingbettercaregivers.org. This information I think Jerome is going to share after our presentation and in an email back to you guys. So if you're caring for a veteran, there's that link. If you're not caring for a veteran but are still interested in the program, we also offer a version of a program, and the link is here. For Caregiver Month, we're offering it free to any caregiver living in the US, so they can follow that link. If you are caring for a veteran, VA caregiver support is offered all of the time. So it's a tremendous program, of which we're one of the programs, and we hope that you're able to sign up. So I'll pass it back to Jerome.
I want to thank everyone for the wonderful presentations about the Building Better Caregivers Family Caregiving Program. Um, we allow people to submit questions for you as they registered for today's program. And so I now like to ask you some of those questions that we received. So I'll start with Candy. From your personal experience, what are the most rewarding and most challenging aspects of caring for a veteran with a chronic illness?
Thank you, Jerome. For myself and caring for my father, you have to remember to be able to give them autonomy, and they are part of the partnership, and not diving in to try to take care of everything individually without their input. I think that's the hardest part as a person who likes to get in and do and be involved with care from the get-go. They need to keep their ability to help make those decisions, and also be able to see them progress and take better care of themselves from the beginning when you do step in as a caregiver.
Another question for you, Candy. What are the main skills or competencies that caregivers gain through this program? And how do these translate into improved care or personal well-being?
Well, first and foremost, the reduction of stress is key for the caregivers, and that does extend into the care that they are giving for their care partners. It helps to build, as Neil said earlier, the self-confidence in their abilities to be a caregiver, as well as being able to think and view situations slightly different or from the care partner's perspective. And all while learning that not feeling guilty for doing your own self-care as a caregiver just improves the overall quality of what you are able to provide to your care partner, and also their quality of life as well.
Our next question is for Katie. Can you talk about the feedback you've received from caregivers who have participated in the program? Are there specific areas where they report the greatest benefit?
Sure. So caregivers that go through the program really love it. They often will share their stories with us, and we have like a library of videos that I'll invite you to where they're sharing their experience as a caregiver and how BBC impacted their life. I would say the one that we hear over and over again is not feeling alone. Often caregiving can feel very isolating, and this program connects you instantly with at least 30 other caregivers that are in a very similar situation. And something that you might post on the discussion board is something that happened. They're right there behind you saying, yeah, that happened to me too. And so that realization that there's just this community of other people like you, where they've can share their success, they can share their challenges, just ends up being really empowering. So much so that the way that we get facilitators who are facilitating our programs, like Peg, they come from graduates of our program, so they enjoy that interaction with each other so much that they end up going through our training program to become facilitators.
This next question that we received, I'm going to ask Dr. Kaufman to respond to. What advice would you offer to new caregivers of a veteran with a chronic illness like kidney disease?
I think one of the major issues is how to work with your healthcare provider team. At the minimum, the healthcare provider should identify whichever of their patients have a caregiver, who that caregiver is, what their circumstances are. Once that's there, if they can become part of the team that's making decisions, the caregiver and the care partner, if they're able to, should be part of that decision making, should be able to get the input, get their questions answered. It's really important, particularly for people with chronic kidney disease, where there's so many different things they have to do for that caregiver to be part of that team making decisions.
And our last question I'm going to pose to Katie. Can you talk about future developments or enhancements that are planned for the program?
Sure. So the core program itself is what we call evidence-based. So we don't change too much about the structure of it, but we're always adding new resources as we're finding programs and other, especially within the VA, they're always expanding the types of services that they're offering to caregivers of veterans. So we make sure to promote those and put those into the program. But something new that we've been doing is really expanding that alumni community. So once people go through the core program, they can go into an alumni community, and we've been having guest speakers in there. We've been having different challenges, like over the summer we'll have like a walking challenge. So we've been adding a lot of programming to our community itself. And then we're launching in our non-veteran version of this, we have a community that we're launching that doesn't require you to be a graduate of the program. If you just want to come in and get some resources and connect with sort of a lighter touch of connecting with other caregivers, we're launching that this month. So that's our newest innovation that we're bringing out, and excited to do so.
I'm looking forward to learning more about that. I want to extend a heartfelt thank you to all of our speakers from the Building Better Caregivers Family Caregiver Program for sharing your expertise and the invaluable work you're doing to support caregivers of veterans and active duty military members. Your dedication truly makes a difference in the lives of those who give so much. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as The Conversation Starter, Questions to Ask Your Healthcare Team About Choosing the Right Therapy for You. That's a brochure. Or the Coping, Living, and Thriving with Kidney Disease brochure. You can also order materials by phone. Join us for the 7th Annual Policy Summit on November 20th at the National Press Club in Washington, D.C. This year's event will bring together key policymakers, industry leaders, and patient advocates with options for both in-person and virtual participation. Registration is open. Secure your spot today. And finally, you can also visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our previously held events and programs, as well as 2024 programs as they occur. We would like to extend a heartfelt thank you to our webinar speakers, Dr. Neil Kaufman, Peg Rowe, Katie Plant, Candy Dana, and Karina Horoshkiv for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.